So HS is a very hard disease to treat. While we do have an FDA-approved biologic for HS, not all patients respond to Humira, the FDA-approved biologic for HS. I have used sort of other biologics off-label in my practice for HS. Certainly IL-17 blockage does seem to be promising, and Cosentyx does have a clinical trial looking at its efficacy in HS, and they're awaiting on FDA approval, which could take some time. So clearly we do know that IL-17 blockage can play a role in HS. So that's one thing. As far as IL-12, 23 blockage goes, they did do a sort of open label clinical trial with ustekinumab for HS, and it did show some trend towards improvement, but then again, it was a small study with just 17 patients, so it's kind of hard to sort of draw inferences on a wider scale. But certainly if you do have a patient that hasn't responded to an anti-TNF, considering biologics that have other mechanisms of action seems worthwhile. Lastly, as far as IL-23 blockage goes, guselkumab is being investigated in a clinical trial with HS patients, so let's see what pans out of that study, but it's too early to tell.